I'm Caitlyn Wang. For the first 25 years of my career, I successfully ran a public multinational corporation. I've demoed products to Stevie Wonder, worked with Guitar Center, Amazon, Harman, Acer, and many other brand names. Bring about 200 products from concept to market. I've managed teams in 3 different countries. I'm also a mother of 2 special needs kids. One is autistic and had very high behavioral health needs. I know from my personal struggles that when someone in the family isn't doing well, the whole family suffers. The current behavioral health resources isn't enough, and it wasn't working for us and many others. I made a drastic decision to retire and prioritize my kids over everything else. I've founded a nonprofit curaJOY to improve the accessibility, equity, and effectiveness of behavioral health resources for families. Numerous public health authorities and research show that people's social and mental health are at a level of crisis. But you don't need any more figures from me. You see it either on the news or with people around you. Problems with school shooting, depression, suicide, substance abuse. Lots of efforts have been put into this. In fact, the U.S. spends more than $900 billion on youth wellness, mental health, and substance abuse, but very little has changed. Why? Because real change is hard. People can't overcome suicidal thoughts, trauma, problems with alcohol with just a few weekly sessions of therapy. curaJOY focuses on providing people with the frequency and intensity of interventions and skill building that they really need to improve their lives. There is a lot of resources out there. When I was still in corporate, I would pick up every book that I thought could help my kids and my family. And I'm ashamed to admit that I didn't get past the table of contents most of the time, let alone implement them with my kids. The modern family is busy. I'm not a bad mother or lazy. There just isn't enough time. Most of us know things that we can be doing to improve our health, but it's the doing that's hard. It's the implementation and hand-holding that people really need. And curaJOY is that missing link for people's emotional wellness. We make social emotional learning accessible and convenient through ads and games for them to work for people, and most important, for them to stick to it. There's a big and growing number of people who need mental health help, but there is insufficient and a dwindling supply of professionals who can help them. curaJOY approaches this problem holistically for practical, systemic changes that will transform the landscape. We focus on delivering here direct to families because most resources out there are referring people to places who might be able to help them, but the availability is not there. What's the use of referring people when they can't get an appointment? No evidence-based practices can be effective when they're not being delivered. Families can't wait anymore. The longer people wait to get help, the harder and more costly for them to get better. Please help us. curaJOY works on delivering immediate, on-demand, 24/7 multilingual, proven behavioral health care to people.